right, good evening. So tonight we're going to continue this journey down the path of what you, as a mom, gets to really decide on this journey of pregnancy and birth. So last week we talked a little bit about the education and the different opportunities or the different choices that you have as a mother. And so tonight we're going to talk more about this word called empower, or where you can empower yourself as a mom, so that you can really understand that there are other options, that there are other possibilities that you have as a mom, whether this is your first time, whether this is your more than once pregnancy. The key is for you to know that you actually have the opportunity to be the captain of your ship or the captain of your team on this amazing journey that we know is pregnancy and giving birth to the amazing kiddos that we have. So if you have questions or comments or concerns, please drop them in the comment section here, and we will go over it. Hey Vanessa, how are you tonight? Thanks for being on here with us. And we're gonna go about 30 minutes tonight. It won't be super long, but more importantly, it's just gonna be a continuance of part one, which was more about education. And so we're going to dive right into it. So really empowering, it's building confidence to ask questions and lead the conversation of your birth. Because again, you get to be in charge. Now that's not what we normally have known over the years. That's not something that has always been out there, but that is something that's very important for you to understand. So again, we want to help you become empowered as a mother. And I always like to start off with our vision. The goal of Delivered, which is the entire workshop, is to ensure that women prepare their bodies and minds for birth so that they can be their best when the moment arrives, and so their newborn child takes his or her first breath in a way that allows them to develop as a healthy, happy child. Our mission is to inform women about the current state of pregnancy and, more importantly, birth, and provide them with alternatives to that path. We aim to empower expecting mothers to have the confidence to take the wheel on their own birth journey in order to ensure the best pregnancy outcomes for them and their child. And so this is super important for us, especially me. This is my passion, to work with moms that are on this path, right? To give information to you. Hey, Carl, good to see you, brother. And so as we go through this tonight, you're going to learn a lot of opportunities, a lot of possibilities that maybe you never understood. I had no idea when I went through this process, right? Had another new patient in here today with her 3.5-year-old, and she talked about this. She talked about how, she just kind of did what the doctors told her to do at that point. And now her 3.5-year-old is struggling, right? This 3.5-year-old beautiful little boy is struggling with development, his speech, all that kind of stuff. And so that's why we do what we do. That's why we're putting this message out there. So you can see, again, this is a 4-week deal, and last week we educated, brought up some topics. This week we're going to talk about empowering you, the critical shift towards your ideal birth. Encourage you is going to be next week. Really going to dive in. We're going to talk about your team tonight, but really encouraging you next week to begin looking at your team and taking that will. And then the 4th week we're going to enhance, talking about enhancing this opportunity that you have to go through your pregnancy and birth. So if you want to go fast, go alone. If you want to go far, go together. And I always like this one, right? Because so many times we feel that we may be alone. But that's really not the case. We're not alone on this journey, and we can go much further with a lot less stress if we go with a team, right? Now, we definitely are looking at these benefits to creating this team, to having the opportunity to be in charge, to take the will that you are going to take. So this one, your birth team, and I've talked about this a few times already tonight. Take the will. Choosing the right birth team for your plan is important. Be sure to interview and assess for fit before choosing the members of your team. So last week we talked about, and we showed a little roadmap, right, about the different possibilities. And we've got the OBGYN, we've got prenatal chiropractor, we've got yoga and exercise, we got acupuncture and massage, family and friends, nutritional support, birthing classes, doula, midwives, right? Those are all options to have on your bus as you drive down this amazing path of pregnancy. And so we're really going to talk about the benefits of having the right birth team and really to create this plan so that it fits your goals as a mother. And so we're going to talk about chiropractic. We're going to talk about midwives and doulas and the importance of prenatal exercise and proper nutrition. We must remember that the mind-body phenomenon described in 9th-10th century textbooks is no less true now than it was then. Most women need encouragement and companionship more than they need drugs. And I really find that this is the case with a lot of the mamas that come into our office, right? It's not about the drugs. It's not about that kind of stuff to really kind of put them down or to decrease that opportunity to make their decisions. More importantly, it's about giving them encouragement so that they can then, or so that you can then become empowered with everything that you have going on. And again, this is a real big topic for me because I want you guys to know that you have the opportunity to choose, right? And so, big question here. Who do you plan on being the captain of your team? Now, last week we talked about who should be, but I want to know who you want to be the captain. And most of the time, when I get this response, most of the moms will say that they're OB. They want their OB to kind of be in charge. And that's great if that's what you want, right? But here's the thing. If they're in charge, they make all the decisions, and you just kind of get to go along with what they say. And that's okay if that's what you're looking for. But that's what we went through. That's what I struggled with. I knew there had to be something more out there, but I was pretty much told to do what the OB told me to do and leave it at that. Right? Nowadays, I know a lot different. And the answer that I feel is that you should be the captain. Whether you choose the OB to be your to be on your team, that's perfectly okay. But at the end of the day, you're the one that should be the captain of your ship or the captain of your team. Now, midwife, right? That's also another great option. And here's a few reasons why having a midwife is just amazing. A lot of times they are a lot less intervention based. So they let nature kind of run its course. They allow baby to do what it needs to. They allow mom's body to do what it needs to. They're really trained outside of the medical approach. So they have a different idea of how things work and function. And the other big thing is they accept fewer clients than an OB, right? So therefore they tend to be better listeners. They really advocate more for you as mama and baby. And they're just really, they make you feel more at home. When it comes time to give birth, your midwife on a level that you definitely do not know your OB. And so I think that's really important, especially going through this process of birth, right? Because when we're under a lot of stress, and we're going to talk about that again tonight, but when you're under a lot of stress giving birth, then causes more complications during that birthing period. Another one on the team could be a chiropractor, right? Of course, I know a little bit about this option, but we're going to talk about that a little bit more here in a few minutes. We also have doula, right? And a doula really is a must for all births. Again, for many different reasons. They really are kind of that buffer between mom and the provider, right? Um, you hire them, mom, you interview them, you hire them. So they're working for your goals and your desires, not for the provider's desires. They're kind of like your coach, right? Um, Almost like a trainer. You hire a trainer to help you get in shape, to teach you how to work out or change your diet, all those things. And that's really kind of what a doula does. They're there for your goals and desires. We also have birthing classes, and there's a ton of different options. Really, know the ones in your area. If you don't, reach out to me, and we'll definitely get you a list of those that you can attend. But you may also want to look for those as well. But there's a lot of different opportunities. But you want to make sure that you feel comfortable in that situation. That is the number one key. We want you to feel comfortable, right? Because that's going to take stress not only off of you, but it's also going to take stress off the developing baby inside. And then we have, a possibility of having an acupuncturist. They're great during the entire pregnancy, but especially if labor needs some assistance. So it's always kind of good to have them there as well. And then, of course, prenatal massage therapist, right? Very helpful during the entire pregnancy. And I mean, just for a ton of different reasons. And I'm sure that you won't argue with that. It always feels amazing after you have a good massage from an amazing massage therapist. Again, if you need help with that, let us know, and we would love to help you out. Now, here's the thing. You don't need to have all those people on your bus that I listed, right? Those are options. Those are ideas. But more importantly, again, it goes back to you need to be in charge of what's going on. You need to be in charge of your team. You need to be in charge of the entire book and the entire bus because it is your opportunity to create the amazing birth and the amazing pregnancy that you're going through. So, chiropractic and pregnancy, how do these two go together? Well, great question, right? That's actually what I love to do. And so it really comes down to the fact that we, as chiropractors, especially prenatal chiropractors like myself, I mean, that's what I specialize. I specialize in prenatal and pediatric chiropractic. And, we always kind of joke around, but it's really the prenatal and pediatric chiropractor extraordinaire. I believe that this is the essence of the right path. This is definitely something that you need to see. But I just want to really kind of talk about the opportunity of being a chiropractor. And we're going to dive more into this. But as a chiropractor on your team, we don't just look at the aches and pains that you're going through. Many of you may not have any aches and pains during pregnancy, and that's perfectly okay. But here's the key. The key is about the nervous system, right? And so that's what we're going to really talk about here. Is getting your nervous system set up so that it can function to allow your little one to develop the way that they're supposed to. And so if we look here, we've got the Webster technique, the specific chiropractic technique for prenatal assistance. And this really, we've got specific, techniques remove intrauterine constraint. It's non-invasive, a very non-invasive and pain-free method. Adjustments allow the baby to return to vertex and effective. We currently have a high success rate in our office. And so, we don't ever say that we turn babies. We don't ever say any of that kind of stuff. All we do is we take a lot of that tension off of intrauterine constraint where it is not allowing baby to move and position itself the way that it's supposed to. And really, that's what it's about, right? Getting you in a position to where you can have an amazing birth when that time comes. Now, we also work on preparing the pelvis so that it's a much easier pregnancy and birth by creating a balance in the pelvic bony structures, muscles, and ligaments, right? And that's what the adjustment does. It also removes tension, like I said, on the ligaments to support the uterus, thus reducing torsion, that intrauterine constraint to the woman's uterus. It reduces interference to the mother's vital nerve system, which controls and coordinates all of her systems and functions, including the development of the baby. Allows for a safer, easier birth for the mother, decreasing the potential for intervention. And that's really key, right? We want to try to allow baby to be to be born in a way with the least amount of intervention possible. Now, how does it? What is beneficial for baby? It removes interference to the mother's nerve system, allowing better baby development, which is what I've talked about. Allows the baby the room to develop without restrictions to its forming cranium, spine, and other skeletal structures. It allows baby to move into the best possible birth position, like I said on the last slide. And with proper fetal positioning, there's a significant decrease in resulting birth trauma caused by intervention. So if we absolutely can get baby into, not only baby but mom, into a much less stressed out state, it's going to help them have a much better birthing process. And that's key. That's key for you as a mom, but more importantly, that's also key for baby, right? Because as baby comes out, and if it's under a ton amount of stress, then that stress is going to wire them in a stress mode, which over time will then cause them to continue to not function and develop properly, right? So here we're going to talk about chiropractic and pregnancy, but more importantly, chiropractic care helps with a better overall pregnancy and delivery. It's going to decrease physical stress on mom's body, as well as stress on baby's body. It's going to decrease birth trauma for baby. Most of the time, when there is a ton of stress on mom and baby during this process, that's when the body just kind of shuts down. It doesn't go through the natural birthing part of it. We also see that a lot of times decreased labor time, effort, and pain when moms are under chiropractic care. But also increased vitality and energy, which are two main important topics, right? So, proper nervous system function is needed to start and continue labor naturally. Now, I love this. This is my bread and butter all day long. The nervous system is what we focus on here in this office. We would scan you, we would do a neurological scan to see how your nervous system is functioning. Since the nervous system is the master computer, the master controller of all of our organs, tissues, and glands of the human body, it is important that it is functioning properly. Spinal subluxations cause nerve interference, which puts stress on the nervous system. So, when we have stress on the nervous system, it does not allow it to function properly. Therefore, it shuts down that master controller or that nervous system. That stress causes dysfunction, input to the reproductive organs. So now, if you're having issues with infertility, right? Now it's a little side topic here, since you probably are not having it if you're pregnant. But if you know of someone that's having issues with infertility, most of the time it's related to a dysfunctioning nervous system. And when that nervous system is not functioning right, it does not allow the proper input or the proper information to go to the reproductive organs, creating that ability to do what it's supposed to do in creating the baby. And so Excessive stress or stress hormones may inhibit labor via oxytocin disruption. So again, stress. Stress is number one, right? I mean, stress is so crazy throughout everything. The body and brain are in constant communication, or they should be, and they both need to be at ease for a successful natural birth. And so when we have a brain and a body that, like this picture here, you can see that the brain and body are not at balance or not at ease because we have so much stress on the right hand side, which is causing it to become out of balance or more importantly, out of ease. Now we've got what we call dis-ease. And that can be disease, but that can also just mean that the nervous system is not functioning the way that it's supposed to. Therefore, creating this issue and this circle of constant stress on mom, on baby, and it just does not allow it to function properly. Um, so this is key. We're chiropractic. We talked about a few slides ago where we talked about the pelvic area, aligning the bones and all of that kind of stuff to allow for an easier birth. But this is much deeper on a different level where we want to get your brain and body communicating properly so that during the natural birthing process, it can communicate to what it's supposed to do as well as to the nervous system of the baby. Um, so if there's a ton of if there's a ton of interference in your nervous system, you're not going to function properly, and that's going to create and wire your baby in stress mode as well. Um, so it's very important for your stress hormones to be lowered, and for you just to be at a more ease during this entire process, not only during delivery, but or birth, but more importantly um, during the entire process. So when the body is not at ease during delivery, you surrender control. So if you look at this picture, you can see the two differences, one on the left, one on the right. You can see the baby where mom and baby are at ease, and that's just natural. It's happening the way that it's supposed to, right? If you look at the right side, it's not. Baby's stuck, mom's stressed, baby's stressed, and so what do? We have to go with the forceps, the vacuum, and yank baby out, right? And so that is not good for mom, and it's definitely not good for baby. So, because the mom freezes because of that stress, and she becomes in this state of protection, her body. This is where the assistance has to come in, right? And so the hospital driven labors, this is where they will kind of start doing that shot clock during the critical times, still causing more and more and more stress for mom. Now, here are a few stats with this. So nearly 40% of births are induced. Over 60% of women choose epidural. Over 80% of births are augmented, the common interventions. In a natural delivery, the mother's body is able to surrender to the innate birth process. So here's the difference, right? Natural, mom's body will surrender. It just goes on in control of the innate birth process, and the amount of force required for birth is substantially less than when intervention is required. Any abnormal strain or stress on spinal nerves. So the current stats are on the rise. And we're going to talk about these, right? And this is why these stats here are why I got in to caring for pregnant mamas during their pregnancy. Not because of the pain, but more importantly, to help them reduce their stress in their nervous system so that these next stats will begin to change. Right now, 1 in 10 children have asthma, 1 in 8 have ADHD, 1 in 4 have allergies, and this is 1 in 68, but there's some other numbers out there where it's more often than 1 in 68 have autism. I do a lot with kiddos that are on the spectrum, and we see a lot of times that they have had some type of birth-related trauma or stress. We go all the way back to the pregnancy, to the birth, and the first few years, and I would say anywhere between 85 and 95% have some type of birth trauma or trauma within the first few years of birth. Pregnancy was stressful, right? And we start seeing this decline. Um, so, why does all of this really matter? Again, birth trauma followed by the toxicity and stress of modern lifestyle can create the perfect recipe for both acute and chronic illnesses. So and I just finished last Thursday. I did a presentation on raising a healthy kid, and we see a ton of kiddos with ear infections in the office that are on the spectrum. Sensory disorders, ADHD disorders, autism, and a lot of constipation issues, colic, and sleep issues. But as you can see from this, uh, and Dr. Tony Ebel, one of my mentors, he put together what's called the perfect storm, and it's about the chronic and acute illnesses that come from all of these stresses. Last week we talked about the 3 different types of stresses. We have emotional, chemical, and physical stresses. And those stresses over time will create this inability for the body of baby to adjust or to adapt to all of the struggles and all of the stresses. And it begins to create these different disorders, the autoimmune disorders, asthma and allergy. That's why we've seen such an increase in all of these numbers with kiddos. I don't remember ever hearing the word autism until I was probably about 21 or so. And it just was not known. I didn't know a kid with autism. I didn't know a kid with ADHD. And I know that some of those things, everybody says, well, it just went misdiagnosed. And there's probably a few of those, but not at the rate that we see today. So if you think about this, we have these kiddos. We get kiddos in with speech delays, right? They come in and we find out their history. And the history was stressful pregnancy, stressful birth, intervention, or sometimes it was not stressful. There was no intervention, but they may have been preemie, right? Or when all of it was said and done, after birth process, they came out and then they had all of these stresses. They had the emotional stress, right? If they were in NICU, if there was a physical stress, right? The birth process itself. If you remember right, last week we talked about Dr. Gutman, who said that when he did his research looking at 1,000 kids, newborns, that 80%, and I was telling this to one of my kiddos today, and he said, wow, he said, that's 800 out of 1,000. And I said, yeah, 80% of those 1,000 kids had subluxation, which was creating interference in that upper neck, upper cervical area. So, pretty crazy, right? Well, if it's left there without being checked, then that's what creates all of that. Well, that's part of that stress. And then we add on the other stresses, right? The emotional stresses of mom being exhausted. Babies pick up on that connection. The other physical stresses, right? The chemical stresses from food, from diet, from if they have to go on the formula because they have difficulty nursing, right? Or mom's not letting down enough milk because her nervous system is stuck in fight or flight or survival mode and she's unable to produce the amount of milk that baby needs. These are all reasons why it is so important. So right here, and I should have jumped to this slide earlier, but our goal is to keep your child balanced and connected during the vital first 3 years. Now, this includes that pregnancy, right? Again, we have chemical stress, physical stress, emotional stress, which creates that subluxation. What can we do? What are some of the things you can do? You can eat clean, you can move often, right? Exercise during pregnancy is amazing. And just try to be happy. You know, a lot of times I'll have patients that have a lot of emotional stress going on. I'll have them go for walks just to kind of slow life down. Breathing exercises are amazing as well. You know, emotional stresses can also be helped with exercise, right? Which again goes to moving often. And it doesn't have to be vigorous exercise, just getting up, moving, being active. And then more importantly, to help decrease that subluxation or interference in the nervous system is to get checked. And that's why we've invested in this technology, state-of-the-art technology, so that we could be the local and community expert, not only in prenatal pregnancy and pediatric, but more importantly, in how the nervous system is functioning. The scans will tell us exactly what your nervous system is looking like, how it's functioning, how it's working. You may feel amazing and perfect, right? You may not have any pain, but are you actually functioning at the highest level, or are you not? Again, if we look at those stresses, could those stresses be impeding that communication for that master computer? So, reduction of stress and anxiety in pregnancy may have significant and long term benefits to offspring and therefore substantial public health benefits. Evolving evidence suggests that some forms of relaxation and relaxation training may improve not only psychological and hormone stress markers, but also meaningful outcomes in mothers and babies. And so that's what we're talking about. I mean, meditation is another amazing one. Yoga, right? Those are all amazing opportunities for you to be able to reduce your stress. The spine is responsible for 80% of proprioceptive input or positive input into the nervous system. Your arms, legs, your extremities, right, is responsible for about 15 to 20% of that positive input. So, why does chiropractic work and why is it important to get adjusted if you don't have pain? Because as we adjust along the spine, we're putting positive input to help reconnect that spine to brain, that nervous system communication. And that is what it is about. So, again, this is about empowering you as well as educating, okay? And we've got, well, we've done that one tonight, right? Now, the next one is going to be encouraging you to really dive in and find your birth team. That's what next week's topic is going to be about. So, tonight we touched on midwife, we touched on doula, we touched on a few other people that should be on your team, but we really dove into chiropractic tonight. Because it's very important that your nervous system is functioning properly so that your baby's nervous system can function properly as well, so that it can develop the way that it's supposed to and the way that it's meant to. If you have any questions, please reach out to us. You can go to our website, you can email us at office@mckinneychiro.com. But we are here to help. We're here to answer questions. More importantly, we're here to empower you to be the captain of your bus, of your team, and to really choose who you want to be on there. It's super important that you take charge and you lead this. And it's not anything that you should be fearful of. You shouldn't be afraid of this, right? If you don't know, just reach out. Do some research. Look, there's tons of opportunities. There's tons of people out there. There's tons of messages that you can find about this. We just specialize in it because we love it. I have a passion for it because of my story. And I want to make sure that these kiddos are not going down this path of becoming another statistic because they were unable to function and they were unable to develop the way that they were supposed to. So again, I just want to thank you for your time. I know that everybody is busy, but my name is Dr. Justin Turner at Expressing Life Chiropractic, and it is our passion. It is our number one thing that we do that we love, to help mamas find their path and find their team that they want to be on, that they want to be in charge of, to have the amazing pregnancy and birth. With that, we'll go ahead and let you all go tonight, and we hope you have a great night.